the same guidelines. You know, how do you feel? What's your base strength like? We build up gradually.
Hello everyone and welcome back to There's No Place Like Home. I'm your host Kath, and today I'm joined by Caroline, who is a physio and women's health physio, to be precise. And you've come in to talk about a topic that I'm incredibly passionate about, and I'm from talking to you, you are as well, postpartum movement.
Yeah, fantastic.
So thanks for being with us.
Well, thank you so much for the invitation. It's a real honour and a topic, that I'm very passionate about as well. So looking forward to our conversation today.
Amazing. I can't wait to dig deep into it. But just for everyone at home and just to get a bit of an idea about who you are and what you bring to the table, can you tell us a little bit about you, your background, your qualifications?
So I'm a physio. I've been working in the field of women's health physiotherapy for 25 years now, which is wonderful. And that's been across different formats as well. So my first introduction to women's health was at the Mercy Hospital for Women, which is a fantastic centre. And from there, I've also moved into private health clinics and practices. So I've had a broad range, and as well as the private practice situation and the public hospital exposure and work. Private hospital Cabrini for a little bit too. Also exercise classes, so that have been done on within the practice that I work in now, as well as through separate clinics.
Yeah, amazing. So you're currently working at the moment at Be Active.
Yeah. So Be Active Physio, where I see patients in patient rooms, as well as we do lovely classes for both pre and postnatal women, as well as women at any stage of their life as well.
Amazing.
Yeah.
So let's talk about, I want to start with what some of the misconceptions are that sit around movement during pregnancy. Let's talk about pregnancy and then postpartum as well. What do you find are misconceptions that sit around this space?
So in terms of prenatal misconceptions, perhaps it's, I shouldn't do exercise because I'm pregnant and but in truth being that we should exercise at all stages of life. But there's definitely better choices of what sort of exercise that we should be practicing.
Yeah. What about postpartum? Because that feels really curly at times, and things that we hear constantly. I mean, they're obviously changing and adapting, and everybody's different.
Yes.
But what are some misconceptions that you know to be?
Yeah, so misconceptions postpartum exercise or movement. Perhaps, that I've had my health check at 6 weeks and I've been given the all clear, I can start exercise. And so let's get back to what I was doing prior to having kids. I'm going to go for a run. But in truth being, your body's not ready. It's been through so much change with pregnancy and with childbirth, whether that be a vaginal delivery or a caesarean. Your body's had an injury. It's been through a lot of change. So we've got to, listen to it and be kind to it and introduce activity and exercise as our body feels comfortable to do so. Giving itself permission to have a day off and rest, or feeling good. So let's stretch and move.
And what does that look like for you in your practice? Because assumably everybody comes from different walks of life when they enter your space.
That's such a good question, because absolutely that'll indicate how quickly someone can return to exercise depending on what their background is, how active and fit they have been prior to pregnancy, during their pregnancy. That's definitely going to influence things. And then also what type of labour they've had. Has it been a really challenging, difficult birth, or was it straightforward? Has it been a caesarean, or did you go through all that labour and then end up with emergency Caesar? Everyone's going to have a different experience, and their body's going to be in a different position when they first come in. So it's really important that everyone is treated individually and each case is looked at, and so we can be, people can hopefully I always talk about don't compare yourself to the person you're sitting next to in your mother's group or what you've seen on Instagram.
Yeah.
But listen to your body. It's your own journey.
And I guess for anybody that's sitting at home, no matter where they're at in their postpartum or, they may not have had babies yet, I feel like there is this thought process around, and you mentioned it earlier, that they've had their 6-week checkup and, what is your thought around that? That looks different for everybody in general. As far as waiting for that 6-week checkup, is that what you look for as a physiotherapist in this women's health space? Are you saying, okay, yes, come and see me at 6 weeks? Or is there something different for you if you're linked in with someone in that prenatal space? What are your recommendations around that?
At Be Active, we encourage women to have an appointment with us prior to delivery to talk about that early postpartum care. But we will also recommend and say come back in and see us about 3 weeks, and that could be telehealth as well, so that we can just check in on how you're going. Because as we were saying before, it's going to be individual. So we can then tailor perhaps what their needs are at that time, support them where they need support, give them advice, what they're struggling with, what they're finding challenging, or if they're feeling really good, give them some safe guidelines with what they can start to introduce and get back to. So often would say about 3 weeks might be the right time as well. But again, it comes back to the individual. Definitely if someone's really struggling, I think it's great to reach out to know, okay, what can I actually be doing as well at this time to help my body heal, help that recovery process. And 6 weeks for physio is more that, okay, now we're ready to really assess where you're at. We're definitely at a position now that we should be safe to start and introduce new exercise and progress things along.
Yeah, I feel like we are very fixated on 6 weeks in
and
that
that's a bit of a magic number. And it's going to be different. It is going to be different for different people. Some people that may be, closer to 8 or more, 12 weeks before they're feeling ready and comfortable to have the mind frame for it, or feel ready, or, so it could be earlier that they've had a, great delivery and their body's feeling good. Maybe they've, had that, they've really maintained their health and fitness through their pregnancy and they're ready to get back a bit earlier. So I think it's important to listen to your body and, make those, build up according to how you feel.
Yeah, I love that. I think the fixation, and certainly with lots of things, but with that special check that happens at 6 weeks and the sign off and everything's going to change at 6 weeks, is so people fixate on that. So from a movement perspective, obviously some people focus on what that looks like, but that 3-week checkup sounds almost as important.
Yeah, I think it is really important just to know what, how can I help my body heal? It is a pregnancy. There's been so much changes to your body. The muscles are stretched, they're weaker through core and pelvic floor, and, the joint and ligament laxity as well, postural changes, less activity and exercise perhaps that we're, weaker through other muscle groups too. So, your body's healing, it's recovering, and we perhaps have changed our exercise habits for that pregnancy, and we can't expect to suddenly be running again at 6 weeks either. Yeah. We have to do some rehab. We have to focus on those muscle groups that are weaker or injured, and we need to build up that strength and foundation, build up activity with increasing load at a gentle pace and a comfortable pace.
So this is a good segue into what that actually looks like. So from your experience, what is the best way to get back into exercise in postpartum? What does that look like?
Yeah, well, I think what I will say first of all is the most important thing initially is rest and recovery. So in those early weeks, allow yourself to take that rest, listen to your body, be kind to yourself, and just gentle movement. I don't think that you've got to be out with the pram walking every day. But if you're feeling good, go for a little walk around the block. But when you're home, that might be 5 minutes. That's all. That's fine. Yeah. It's important to start slowly. I would say, 5-10 minutes max when you initially start walking, and just building up from that as you feel comfortable and as you enjoy. And if you've done something like one day and you've really felt great and you've gone for that bigger walk and then afterwards you're feeling a bit achy, a bit sore, don't worry. That's your body saying that was a little bit too much too soon. Rest, recover, take it a bit easier on your next walk. But really, to start with, gradual exercise, just walking, enjoying the fresh air, whether it be with or without your baby. Maybe you want a little bit of self-time as well.
Yeah.
But take it slow.
Yeah. So someone comes in to see you, whether it be like ideally that 3 to 6 week mark, 6 weeks again. So their first appointment with you, what are you looking for in that checkup? Or assessment?
So I'll probably take, if it's more, they're at that 6 week mark, so it's more about a general postnatal assessment. 3 weeks, it's more of a care check, I think. I'm looking at their, have they got back pain and posture with feeding, or do they have they had a challenging delivery and they're really sore in their perineum? So that's going to be that early care check, perhaps. At 6 weeks, the things that we're really interested in, I'll be looking at their posture. So, checking how they're moving generally. And then looking at more specifically their abdominal strength and function. What is their core strength? But also we use ultrasound at our clinic, and so we can see, are they activating their muscles correctly? Are they getting the correct recruitment of that? And are they able to maintain that hold and action through different levels of exercise? So we're looking at abdominal muscle function and strength, but also looking at the anatomy and like if there's a diastasis rectus. So that's where they've had stretching to that fascial band between the right and left side of abdominal muscles, called a DRAM. I'm sure most people have heard of it.
Being poked at postpartum.
Exactly. So we'll assess for that as well to see where is that at? How's that recovery gone? Do we need to do something that'll help that recover further? And then also, as well as abdominal muscle function, we're looking at pelvic floor function. For a general postnatal assessment, that again we at our Be Active will do with an ultrasound. But for someone that's specifically symptomatic, or perhaps on ultrasound I haven't seen much action, or they're really struggling with it, I'd then recommend that they have an internal exam, a vaginal exam, so that we can assess the actual strength, endurance, coordination of the muscle, how well it's working, what the resting tone is like as well. Are they actually overactive? Is that the issue?
It's interesting you talk about that, because lots of people don't know that could be a thing. Like, I'm super fit. I was doing lots of Pilates, running, going to the gym prior to having a baby. Like, why can't I get this together in their postpartum? So that overactive muscle use is just as important to address.
Important, absolutely. And I really, prenatally, I really try to teach women about pelvic floor, and I'm not worried about how strong your action is. I actually want you to know that you can turn it on, but you can turn it off. You can really relax it. So that's a big focus of pelvic floor exercises in pregnancy and postpartum as well. That we've got a strong action, but we can relax it too.
Amazing. I think all of this is really important to inform people in their pregnancy, obviously, but at any point in their postpartum, like, is there a point where you're like, oh, sorry, it's been 6 months, I cannot see you because you've done a lot of damage now, or you haven't seen us? Like, I know you spoke about the fact that you see people throughout their journey postpartum as well as much further on. But what does that look like? Say I'm 9 months postpartum, I've done absolutely nothing about it, and it's just now that I'm thinking, I probably should have had that checkup.
I always say, that's so good you've come in. It's never too late.
Okay.
And sometimes it takes that long before mentally you're ready. So, in the ideal world, I'd love to see everyone at, that earlier time. But that doesn't always work, and that's okay. Whenever it's the right time for you to address it, or I can now. It can be so overwhelming with a newborn, and so it's never too late. you can always start at any stage. But 9 months you can't expect to go, oh, I've passed that, 3 months I should be able to run. You've actually got to look at what's the foundation like, what's your strength like, and sort of make sure we have good, healthy, active core and pelvic floor. So we're not returning to high loads or high intensity exercise until that's strong and can support you, because we don't want any injuries or incontinence or prolapse to develop by returning too soon.
Yeah.
Or before we're ready. Not on a time frame, but as individual.
Yeah. So you spoke about earlier, obviously we know that there's a big difference in recovery physically from cesarean or vaginal birth. How does that differ with your assessment and how people return to exercise, I guess, or movement, we'll call it?
Return to exercise and movement. I give the same advice, whether it be a vaginal delivery or a cesarean. It really is no different. It's no different in terms of the advice of you've got to listen to your body, and we build up gradually depending on what your strength is like, what your symptoms are like. And, so for someone who's had a Caesar, they might find that they can connect and that pelvic floor is working more quickly and back sooner than someone that's perhaps had a longer second stage or an instrumental delivery and that pelvic floor has had more trauma or so it is going to be weaker in those early, that recovery stage. So there will be some difference, but it comes back to being individual, but the same guidelines. You know, how do you feel? What's your base strength like? We build up gradually.
From a physical perspective, when you're doing these assessments, can you tell if people are not giving you all the information you need from a physical perspective in what you're looking at? Is there ways that you're, like, say somebody says, look, I'm just absolutely desperate to get back to exercise. I'm feeling fine. Let's just do this. Like, is that something that you have had experience in that, you can actually see physically that may not match up with reality?
Well, absolutely. When we're going through our assessment, I can see if they're actually not coordinating their muscles the right way. And so maybe they're bearing down when they're doing their core work, and that's not going to be good for their core or their pelvic floor. So we're definitely assessing that function and guiding because of that. Also in our assessment, I'm asking all those questions. I'm asking, what's your bladder control like? What's your bowel control like? Do you have any heaviness? And so if there are little asterisks from that, I'm asking about their birth experience, about their pregnancy. So there may be higher risk factors, so that's going to make me delve a little bit further. So we definitely want to explore those factors, and but so through questioning, through our subjective assessment, or through objective and looking at how they're moving, how they're passing those tests will indicate what advice I'll give. So not ever someone might come in going, I really want to do this, and it's like, I want to support you, but let's do this safely.
Yeah. And so what do you see that is a risk in going too hard too soon?
Yeah, so particularly for pelvic floor, so say if you're returning to running too soon, so you're desperate to get back, you want to start that running, and we're doing it on a weak pelvic floor, we really causing some changes, some anatomical changes, and that can lead to stress incontinence or perhaps prolapse. And prolapse is where the pelvic organs have started to drop down, so bladder, uterus or bowel, and that can feel like a really heavy discomfort or a bulge in the vagina. That's tricky, that can cause some permanent change and discomfort. So it's really important to not overdo it early, so that, you love running. We want to run long term. Don't just think about, now. But I want to be running, playing tag with my kids. I want to be kicking the football with them. I want to be, doing a little run along the beach with them. So let your body heal, let it recover, everything in good time. And it's worth getting that assessment. Am I doing my pelvic floor exercises correctly? Is it strong enough? Not just pelvic floor. We also look for return to run. I'm looking at their core strength, their glute strength. Are they passing those tests to know that they're not going to cause injuries or discomforts?
Yeah, because it's something that is such a push in this society of you got to be what you were before.
Yeah.
So, you know, that urgency to return fast is probably prioritized more over let's do it properly.
Yeah.
Yeah.
Totally.
Patience is a virtue.
Yeah, and it can be frustrating, I think. You can I remember, I've got 3 boys, and I remember after having my first child and you're looking in the mirror and you're like, what happened?
Yeah.
And it's really hard and it can be really upsetting as well. But your body's amazing. It truly is. And it's so important to take the time. It'll like it's 9 months of change, at least 3 months plus of postnatal recovery, more.
Yeah.
And we've just got to be kind to ourselves and give it time. And, it's my youngest is now 9 and, I reckon it's still changing. Like I'm still changing and it's still, body's definitely different, but it's, I'm healthy, I'm strong, and but definitely it's it's a work in progress.
I guess like when we're talking about the pelvic floor and we're talking about the anatomy that kind of sits around that.
Yeah.
Talk to me about pelvic floor dysfunction. What does that look like?
Yeah, so pelvic floor dysfunction can be a number of different things really, but it could be urinary incontinence. The most common form after having a baby would be what we call stress incontinence, so that leakage with cough, sneeze or exercise. But pelvic floor dysfunction can also be prolapse, so that feeling of heaviness in the vagina, the heaviness in the perineum. It could be bowel symptoms, so constipation, or it could be urgency or difficulty with controlling wind. Or it could be pelvic pain. Yeah.
And as far as like what the most common issue is, what would you say in your assessments and your knowledge? What does that look like?
Probably stress incontinence is the most common, and approximately 1 in 3 women will experience stress urinary incontinence after having a baby. What I will say here as well actually is even if you've had a caesarean, your pelvic floor will still be weaker because of the effects of pregnancy. So you're definitely more likely to have some urinary symptoms or pelvic floor dysfunction symptoms after a vaginal delivery in the early stages. But at 1 year postpartum, vaginal delivery versus caesarean delivery, same number of women have urinary incontinence. So it's important, regardless what delivery you've had, that you do look after your pelvic floor health.
So you've mentioned stress incontinence. What does that look like as a symptom?
Yeah, so that leakage. So I've coughed and I've wet my pants, and that could be a few drops, or it could be a larger loss.
Yeah,
and unfortunately, a lot of women go, "I'm a mum," that's just what happens. But you don't have to accept it. It's something you can definitely do something about and not put up with.
At what point are you thinking to yourself as, having worked in this field for over 25 years, that's normal for you to experience that in those, like the initial period post-delivery, whether it be caesarean or vaginal delivery? Like, do you have a normal limit that sits around that, or are you like,
there's
Kath,
no normal? It's common.
Yes.
But it's not. Don't live with it. Do something about it.
It's so interesting, isn't it? From certainly, like speaking with people of my mum's generation.
Yeah, they just put up with it.
Yeah. Oh no, I cough. I wee. Yeah. That's normal. But you're saying absolutely not.
Absolutely not. Don't accept it. It's something you can fix.
Yeah.
Something you can make, and it makes such a big impact on your social esteem, on your quality of life. So do something about it.
So I, in line with that, would love to know what you feel like the benefits of postpartum movement is for you.
So good. Yeah. We definitely need to work on those muscles that have been affected by pregnancy and childbirth. So you do need to do specific specific exercises for core and for pelvic floor.
Yeah.
In terms of when that starts, it's actually a bit controversial at the moment. There's new info coming out. I recently did an update, which is fabulous, but in some cases it's perhaps best to rest and start pelvic floor too early as well. So again, it's individual, and this is where contacting a physio, speaking to a physio, whether it be on the maternity ward or reaching out to a women's health physio privately, to get some individual advice. But it's important to do pelvic floor exercises and core exercises, definitely from, that 6-week on point. And then also, as I mentioned earlier, walking early is great, but it's after 6 weeks your body has had that, you've done your rest. We've perhaps done compression as well for abdominals and pelvic floor. I didn't talk about that, but I love compression too.
Yeah.
And that early postpartum compression is so great for both the abdominals as well as the perineum. So it just supports the muscles, it helps reduce inflammation, discomfort in the perineum. Really great for if you've got a DRAM, really great for that support through the muscles and the fascia. And research has shown it's great for recovery.
So when you talk about compression, are you what do you specifically use in your practice?
Yeah, in our practice we use the SRC brand, but there are a number of different good brands out there.
Yeah.
But you want something that comes up high, so it's supporting the full trunk.
Yeah.
So the abdominals, they run from the pubic symphysis all the way up to the sternum. So you need something that's covering that length.
Yeah.
That's firm, but also you want compression to the perineum. So if the shorts have a sort of gusset to it, so it can tuck in really firmly, but just your leggings aren't enough. You want something that's firmer. A medical grade compression is ideal.
Yeah.
So, something that's, and you want to wear it as much as you can early on. It's great from when it's comfortable. So if they're pretty tight.
Yeah.
If it's uncomfortable to put on in the first few days, leave it for a week and then start to wear it when you feel comfortable to put it on and off.
Yeah.
But great to wear as much as you can. So that might be nighttime as well, for the first, up to 6 weeks.
Here we go again, 6 weeks. It is the key word for many things, isn't it?
Again, it comes down to how you're feeling,
of
course, and then gradually weaning off it. But some women, particularly if they've got a significant DRAM, I'll say keep wearing it up to, give it another 3 or 6 weeks. Use it for that support.
Yeah, amazing. So the benefits of having this, these different tools that we use in postpartum to help facilitate recovery. So your compression shorts, your getting back to physical activity in a slow way.
Gradual way. So lovely to do, just particularly with breastfeeding and all the different strains that are on our bodies with a newborn. It's great to do some gentle stretches, some gentle movement, gentle activation through core, depending on, how we feel, and walking. But then as we're feeling more comfortable, as we're feeling ready, then we can gradually increase. So this is where we say, 6 weeks, come in, have that checkup. What do you like? What can you do? But usually around that time you've had that natural healing going on and we're ready to start loading more. So you can start doing some gentle resistance, whether that be Pilates or some light weights.
Yeah.
Once your locky is finished, so your bleeding's finished, getting back in the pool for some swimming, beautiful exercise. You might feel comfortable to sit on a bike and you can do some spin or some cycling. I had some great things you can have set up at home, which makes exercise at home easy with a stationary bike perhaps. But low impact, light weights, start gradually building up intensity, building up resistance as your body feels comfortable. And in terms of core as well, not going straight to planks on toes and those sort of things, but starting with lighter core exercises, increasing the difficulty as your body's ready, as long as the quality is maintained and the good techniques maintained.
Love it. As my final question, I would love to know, what changes you would love to see happening in the healthcare system to help support postpartum care in this way.
Yeah. Gosh, that's a big question.
What about we can even just talk about your particular realm.
I'd love everyone to come in and have a pelvic floor check.
Yeah.
I'd love everyone to come in and do just make sure they're activating, exercising correctly, and so they're not doing harm. I hope women feel supported. So, I mean, I love home. Home is lovely. Women need to be supported. And I think it's really important to take that time to rest and recover. So that's really important. But then I know what I wanted to say as well. With exercise, as you're getting back to exercise, we need supports around us. It's really hard. And having a newborn, having a baby with us is so challenging. It's a huge obstacle for a number of mums. So finding how can I bring this in, can I bring my baby into a Pilates class with me or a group class? Is it that when I go for a swim, I swim with another mum from my mother's group and we take turns sitting on the side of the pool with the babies?
Yeah.
You need a community. We need a community having a baby.
Yeah.
And so that's probably what I'd love to see is really that community support, helping mums. But get back into exercise and enjoy it. Exercise with a friend. I think the other thing it's really important, as you say, it can be 9 months before you return. That's okay, but exercise is really beneficial, not just on a physical level, but on a mental level as well. And it's important through all stages of life. It's really challenging postpartum because we're sleep deprived, we're sore, and with time poor. But we've got to work out how do we make that happen, and just chat with our partners, chat with our community. How can we give ourselves that time? How can we make it work? And even if it's 10 minutes, awesome. That's great.
Yeah, really prioritising what that looks like for their own specific return to movement.
Yeah.
So that investment in their wellness.
Yes.
Yeah.
Really important. And they feel so much, it's that, and so clinically I do see that a lot when they come to their first class and they're like, oh my gosh, I felt amazing. Like just moving.
Yeah.
Our bodies aren't made to sit all day.
Yeah.
At all stages of life.
Yeah.
We respond well to moving, but it has to be moving in a, don't suddenly expect that I can get back to doing what I was before. Build up gradually, listen to your body. But movement's wonderful.
You've given us so many gold nuggets today, I think,
good.
Caroline.
I hope so.
It's been so lovely to talk to you. Thank you for sharing your wisdom.
Oh, thank you for having me. It's been lovely to chat.
Thank you so much.
This podcast represents the opinions of our hosts and their guest speakers. Views and opinions expressed in the podcast are our own and do not represent that of our places of work. This podcast is for informational purposes only, and content here should not be taken as medical or professional advice. Please consult your healthcare professional for any personal recommendations and medical care. While we make every effort to ensure that the information we are sharing is accurate based on the best available information at the time of recording, we welcome any comments, suggestions or feedback via our website contact form, home.com.au/contact. Names and details of personal experiences may have been changed to allow for anonymity and privacy. To join the conversation, join us on social media at Home Postpartum.